Rasha, Kelej and your team. So what we'd like to do is really use our experiences and our platforms that we're currently engaging and incorporate infertility into that discussion. I think it was my sister from Ghana and a few other of my sisters who mentioned the problem around stigma and infertility, and why in African countries the social and the cultural issues and the value we attribute to children makes infertility such a difficult topic to discuss. So we know that infertility is not just a health issue, it's also a social issue. And part of fixing it is really ensuring access to quality reproductive health for not only women but for men as well. The challenge in Namibia, and I think Merck Foundation will be instrumental in this challenge, is that our infertility services are not incorporated into our public health services. And the consequence of that is that we do not have any statistics around infertility in Namibia. The only statistics we have are private health facilities that are very expensive and not accessible to the poor. So in addition to the stigma, there's also a lack of data. And that is really a critical aspect that we need assistance on. The lack of a legal framework is another challenge, and it's good to see that Merck Foundation does give support in that respect. In terms of the lack of experts, we're fortunate that Merck Foundation has sponsored 4 experts. And one of the solutions around the high costs is really to integrate it in other health reproductive systems.
Merck Foundation CEO Dr. Rasha Kelej meets the President of the Republic of Namibia, His Excellency Geingos, to discuss Merck Foundation's long-term partnership with the First Lady of Namibia, Mrs. Monica Geingos, to break infertility stigma and to build healthcare capacity in the country in the fields of diabetes, cancer, hypertension and fertility care.
First, I'd like to acknowledge and thank Madam Monica, the First Lady of Namibia, and the Ambassador of Merck More Than a Mother for the great passion I have seen these 2 days. And actually, from the minute we met until now, I've seen a lot of progress, so thank you very much. That there is certain things you needed to change, like the narrative, like you said. There is lack of information. So we need to improve access to information about prevention, about male infertility. So media, by the training we are going to provide, and the Media Recognition Award, and the Fashion Award, and the Filmmaking Award, all these things will sensitize the community, be the voice of the voiceless, break the silence.
Yesterday we had a very eye-opening meeting with people affected by infertility. And one of the things that came out very clearly is the number of myths around infertility. So a lot of the ladies were talking about their suspicions that they were promiscuous. And as we live in a gendered world, a man who's infertile isn't accused of being promiscuous, it's the woman. But there's a belief that in order for a married couple to cement your relationship, you must share a child. A child isn't a psychologist or a marriage counselor. A child doesn't save a rotten marriage. Or a child doesn't strengthen a marriage that has flaws. Either you have a good relationship or you don't. So stop this, when is the baptism? I understand it. But if I experience it like that, I can't imagine the pain it causes those who really do want to have children, who really are of reproductive health and age, and it pains them. Fertility is a shared responsibility, and we do want to engage men more in this conversation, because at the end of the day, a woman is not just about her reproductive capacity, but neither are men. It is a 50-50 issue.
Best part of Merck More Than a Mother, the children story and the meeting all of you, the future leaders and the change agents to create this culture shift. You don't have to wait until you are older. You can start now with your families, with your neighbors. You will be one day a neighbor or a colleague, or maybe even, God forbid, you will be facing this problem. You know now what to do. You know now how to support yourself, support your family, support your colleague, support your neighbor. Value yourself. You need to own your space in life. And you need to know that you are more than mother.
And then I'd also like to thank Dr.Rasha for coming, not only to Namibia. In this time of coronavirus, nobody wants to travel, but she's here. We thank you for your commitment to this topic. I know how passionate you are about young people as well, and for the hard work you do and for making this publication and this little booklet possible. That the family planning discussion has to be holistic. When we speak to teenagers, we can't just speak to you about teenage pregnancy and making sure you have children if and when you want them, and planned pregnancy. We must also teach you that one day when you are in a position or want to have a child, it's not an automatic, I want to have a child this year, therefore I'm going to have a child. It doesn't happen like that. And certain things you do as boys and girls can impact that ability one day when you're in a situation where you want to have kids. What are those things? And it's many things that we need to be careful of. Substance abuse being one. So many of you are at the age where you're starting to become curious about alcohol, drugs, particularly marijuana. These things do have an impact on sperm production in males. It does have an impact on fertility in general. Boys, I see many of you like these tight, skinny jeans, where your things are a little bit squeezed. It has an impact on fertility. So fashion is important, but we must be pragmatic about its implications. Unfortunately, some of the consequences of sexual violence, rape on young girls, does result in infertility. Early sexual debuts, it does result. So it is a topic, so many people, when they are unable to conceive, it could be a number of things. So we don't know what causes many people's infertility, but it does happen to 1 in 4 couples.
Your Excellency, thank you very much for the great honor to have some time of your valuable time during this very difficult times and the global crisis and pandemic. But I'm sure that working all of us together, we will overcome this challenge and it will be another milestone of our success in the future.
I'd like to take this opportunity to greatly appreciate the valuable partnership that we have with Merck Foundation and to be part of this fantastic platform of African First Ladies as the Merck More Than a Mother Ambassador. We have managed to have more than 21 local young Namibian doctors enrolled for the 1-year online diploma from the South Wales University in the fields of diabetes, cardiology, endocrinology, respiratory medicine and acute medicines. We've had 8 doctors from different regions in Namibia enrolled for the online 1-year diploma and the 2-year master's degree in sexual and reproductive medicines, which will add significant value to women's health and will reshape the landscape of fertility and reproductive health nationwide, and also improve access to quality and equitable healthcare to coronavirus patients and risk groups.
I'd like to thank you from the bottom of my heart of all the follow-up and the partnership and the commitment and the close collaboration we have done, despite the fact we cannot see each other, which I'm very sad about, because we used to see each other at least twice a year, but we couldn't do that this year and last year. But we continue working and we have a great achievement and milestones in transforming the healthcare sectors and building capacity of healthcare providers and medical workers, which I take the chance to give them a big salute and all the respect and love to them, because they are our heroes and they are the ones that defending us in the first line. They are our first line defender and our army.
Infertility has been relatively invisible to policymakers and at great risk to those who suffer from it, particularly women. Many of our public healthcare systems do not treat infertility, which makes it difficult for low-income and rural women to access the correct information on the cause of their infertility and their possible treatment options. And I'd like to thank the Merck Foundation for providing this important platform to discuss infertility, stigma, and related issues, and to ensure that the work that everybody on this call is doing around the issue of reproductive health and infertility. I'd like to specifically thank Dr.Rasha Kelej for her leadership. I was not surprised when I saw her recognition as the 100 most influential Africans, Dr. Kelej, it's no doubt that your personal and professional commitment has really brought us all together.
We had, until now, provided more than 1,470 scholarships to doctors in 50 countries, which is a huge, huge milestone, a huge footprint. These doctors, they will and they are already contributed to transformation of patient care landscape in their countries, because many of them was the first specialist in their countries.
Our Merck Foundation alumni from 50 countries who are with us here today, either physically or virtually. I'm very proud of your success in finishing your scholarships. Congratulations to you who have graduated. You are the future healthcare expert in our countries.
So you heard a lot of similar things. A lot of the programs are similar. But one thing that you didn't hear any of us talk about is the integration of infertility treatment in public healthcare systems. Because that is the one thing we are all struggling with. I know there's policymakers and academics in the room. And the cost of providing this treatment is often what we see. But what we're not seeing is the hidden cost of what it takes to treat a society that does not want to deal with an issue. And often what we're not talking about enough is the burden that couples or individuals who suffer from infertility go through in order to fund their treatment, whether it's in different countries, like the First Lady of Botswana said, or trying to find money to pay private healthcare providers in their own countries for infertility treatment, which often isn't entirely successful. So what Merck is doing is what it can do. It's dealing with our mindsets, and it's really creating an environment where we all understand that the end goal is to make access and affordability of infertility treatment key as we deal with all of the societal issues at the same time. Infertility isn't a single issue. It has so many aspects to it. So the multi-dimensional approach that you're seeing being used by Merck Foundation and that you're seeing that the First Ladies are applying in their respective countries is exceptionally important. It's exceptionally important, Dr.Rasha, to have this conference now, because all of us are focused very much on COVID and all of the consequences. So issues like infertility that we've historically neglected are even lower in our priority list than what they used to be. So thank you for the timing. I think the timing has been perfect. Thank you, my sisters, for your presence, and for Merck Foundation for recognizing the impact and importance of the role of First Ladies and advocacy. Thank you very much.